Welcome back, my good people, and in today's video we are going to discuss about chickenpox into details. Basically, this disease is caused by a virus called varicella zoster virus. In fact, it is also known as varicella. So varicella zoster virus is a highly contagious virus that normally affect human beings, and the varicella zoster belongs to the family of herpes, and this herpes virus family poses more problems to both human beings and even animals. If you consider human beings, it causes what we call herpes zoster virus infection. It causes what we call Epstein-Barr virus infection. Those who have known what we call Kaposi sarcoma, and even cytomegalovirus. That all those viruses we are not going to discuss about them in this particular video, but this particular varicella zoster and this particular family of herpes normally pose threat to human beings and even animals. Now, because this disease is highly contagious, meaning you can get it from your neighbor, your friend, your child, or anyone that is close to you, those who have been affected or infected by this particular virus. If you touch somebody, if you hug, even if you kiss, if you touch those surfaces where the person who had chickenpox has touched, if you share bathing materials, if you share even clothes, you can get this particular virus. It's an airborne, so meaning if you cough, sneeze, particularly when you have it, then automatically you can spread it to the other people who have no immunity. We are going to discuss about how somebody can form immunity when we are looking into details of pathophysiology. Mothers who are pregnant can even transmit this particular chickenpox intrauterine to their unborn babies, and even during delivery and nursing when they are breastfeeding, because the mother must be always in contact with the child. So if at all the mother had this particular virus in her system, it will even affect the child, and this can be very, very fatal to the child. Note that this particular virus, chickenpox, the varicella, is very, very virulent. It's very, very virulent and highly toxic to adults even than children. Mostly, if at all the adults get it, it will manifest very fast, more than even children, but very rare. Mostly we get that children normally comes to the hospital when they have this particular chickenpox. So that one calls for when we are going to discuss about clinical presentation. About 10 to 21 days, that is about the incubation period of this particular virus. If you get it today, it will take around 10 to 21 days for the rash to manifest in your body. And now, how do this particular chickenpox present to us? When you get a person having red spots on the face, the red spots can start on the face, can be on the hands, can be even on the trunk, can even affect the groins, even the anal area, even the scrotal area, and this might present with an intense itching. There may be formation of blisters, the papules, those swellings all over the body, and when those swellings are there, they are very itching, and those blisters, they are normally itch, and a person may also present with even fever, nausea, and sometimes vomiting. And when secondary infections occurs, fever might go so high at around maybe 38 degrees centigrade that may even cause somebody to convulse if it is not taken serious. So let's be very, very vigilant, and if you see this particular blisters, red spots covering all over your child or even adult, kindly rush to the hospital for proper care and management. Sometimes even some people might present with running nose or even the nasal discharge, and by that time the virus can spread very, very fast, because if you sneeze, if you cough, you might spread this virus because it is highly contagious. Headache and muscle pain can sometimes be present in this particular person, coupled with even tiredness. When you have been exposed to varicella at a younger age, then this normally activates the immunoglobulins in your body. We have the immunoglobulin G, immunoglobulin A, and immunoglobulin M. Now, immunoglobulin G normally help us to confer immunity when you have this particular virus, when you have been infected with this particular virus at a tender age. And this normally help you not to get another infection. Even if you get now, the clinical presentation will be very, very vague. It will not manifest the way it manifested during your childhood. So that is why if you get that somebody had chickenpox at a tender age, it's very, very difficult to get chickenpox when you are an adult. And varicella zoster normally have a latent period in your body. It normally stays there, relaxes there for a longer period of time. And this longer period of time can take around 50 years. And there is a nice documentation that I want to share with you together. And this one says that after primary infection with herpes zoster virus, it is hypothesized that it spreads from mucosal layer to the epidermis, to epithelial layer, and these lesions normally remains and attacks the sensory nerves. And this normally remains on a latent period in the dorsal ganglia for as long as 50 years. Now, when your immunity goes down, then it will be reactivated, and this one will result in what we call herpes zoster virus. And herpes zoster virus may even cause what we call post-hepatic neuralgia, and it can even affect your face. So herpes zoster virus, we will discuss that into details in another video to come. Prevention of chickenpox is very, very key. And the number one thing we are going to do, if one of your family member has a chickenpox, you should be able to isolate this person. This person should not be able to share beddings, even washing nets, or even drinks, or even cups with other people, because we do not want other people to get this particular disease. And number two, all the beddings and clothes of this particular person should be disinfected with chlorine. And a very good example is we have Jik. Vaccination is also available in some parts of Kenya and in some selected facilities, though it is not one of the programs that are issued by the government in Kenya, expanded program of immunization. It is not in the immunization schedule. So when you want your children, or when you want to be vaccinated, you should be able to walk in any government facility and ask. You will be given direction of where to find this vaccination. Because this particular disease presents with intense itching of the skin, you should be able to trim your fingernails and even put on gloves. We do not want you to scratch your body, because scratching your body will bring what we call secondary infection. Secondary infection, that one bacterial may arise and may worsen this particular situation. We normally advise that when you have chickenpox, it's advisable to bathe with warm water. This will relax your skin, will smoothen your skin, and it's also hypothesized that when you bathe with warm water, when you have chickenpox, it normally prevents secondary infection. And secondary infection, as I've said, bacteria can set in when there is secondary infection, and this might result into fever, muscle pain, headache, general body tiredness, that we do not want you to face this particular problem. In treating chickenpox or management of chickenpox, the number one goal is to prevent this itchiness, because if we allow you to scratch your body, you will develop secondary infection that we are talking about. So we give you a zinc oxide, popularly known as calamine lotion. You've seen some people who have chickenpox, they have applied lotion all over the body and they look white. That particular lotion normally prevents you from intense scratching of your body. Of course, we'll give you an antiviral medicine, that is a cyclovir or via cyclovir, and this one will be given to you according to your age and according to your weight. Also, we'll give you tablets that can control the intense itching. We can give you antihistamines like Piriton, that is chlorophyramine malate. We can give you loratadine. We can give you levocetirizine or even cetirizine. Secondary infection by bacteria, this one we may introduce antibiotics, and we have very many range of antibiotics that we can introduce into you depending on how you are presenting in the facility. And again, for fever, headache, and general body malaise and body pain that might result because of this particular chickenpox, we will give you some analgesics, that is acetaminophen or even paracetamol, to help you manage pain. If you feel that you are so happy with the way I presented this video, you may be able to watch another virulent virus called human papilloma virus, #1 cause of the cancer of the cervix. Watch this video into details and it will help you and it will help a friend, and do not forget to share this video about human papilloma virus. See you in the next video. Muchas gracias.